Tooth decay, when left untreated, can progress to the innermost portion of the tooth, called the pulp, and may also cause an abscess to form at the root of the tooth. Endodontic treatment, which is more commonly known as root canal treatment, is required when decay has reached this stage. During this procedure, all decay is removed using a drill, and the upper portion of the pulp is also removed, giving access to the root canal. Filing of the inside of the tooth helps to remove any remaining infected pulp, and the root canal system is cleaned. A material called gutta percha is used to fill and tightly seal the root canal system. This material is bioinert, so it does not react with the body. It is inserted, impacted, and cut to the desired shape. The remainder of the tooth is restored temporarily with a composite material which is set using a dental curing light. If the tooth shows no further signs of infection, it is later restored permanently.